Welcome to the Senior Advocate Virtual Town Hall on the coronavirus. My name is Stephanie Smith. I'm the president and owner of Senior Advocate. The focus of our company over the past 20 years has been on helping to educate seniors ages 55 and over. We also specialize in collaborating with healthcare professionals who provide senior services. In the past, we have provided relevant information by publishing a print magazine and more recently by hosting large educational events throughout Hampton Roads. Now, as we all know, the times have changed, and during this coronavirus pandemic, all of our current Senior Advocate events have been rescheduled to later dates. While we understand that we should not be currently gathering in large numbers, we still strive to educate our seniors by sharing timely information with them. So we have created this virtual Hampton Roads Town Hall to answer some of the questions that we've received from our Senior Advocate followers. I'd like to now introduce you to our panel members. We're going to start with Paul Gaden. Paul is the president of Sentara Princess Anne Hospital and also the president of Sentara Lifecare.
Good morning. Thanks for inviting us here, and it's our pleasure to answer questions and give information to our seniors in our community.
Thank you, Paul. We also have Dr. Lisa Price-Stevens. She is the Tidewater Market Chief Medical Officer for GenCare Senior Medical Center.
Good morning. It's so nice to be here. Look forward to having this town hall and collaborating and engaging in a great discussion with you this morning.
We have Walt Zaremba. He is the founding attorney of the Zaremba Center, which specializes in estate planning and elder law. He's also a longstanding member of the York County Board of Supervisors.
Good morning. My privilege to be here representing the citizens of York County as well as the greater Tidewater area. This is going to be a really exciting discussion amongst the five of us, and I look forward to it. Thanks so much.
Thank you, Walt. We have David Clemens. He is a financial advisor and portfolio management director at Morgan Stanley in Williamsburg.
Hi, good morning, Stephanie. Thanks so much for putting this together. I think it speaks very highly of Senior Advocate to be able to pivot during these times, take advantage of the technology that we have out there to be able to stay in contact with everyone in our community. So thank you for putting this together and looking forward to a great conversation.
Thanks so much. Last but not least, we have Anna Little. Anna is the broker and director of sales and marketing for Atlantic Shores Retirement Community.
Hi, Stephanie. Hi, everybody. I'm excited to be here. And like you, I'm so used to being in a big event with people in person that it's hard to get used to these changes, but I'm looking forward to, using this technology to continue our businesses and our lives and the lives of the seniors that we encounter every day as much as normal as we can.
Excellent. Thank you all for joining us. This is going to be great. I'm looking forward to getting some answers. Why don't we start with you, Paul? Can you give us the most up-to-date COVID-19 statistics in Virginia and then more specifically in Hampton Roads?
I'll be happy to. We look every single day at the Virginia Department of Health's website, which has got a fantastic portal to the information site that the state has set up to include statistics as well as just information and latest updates around how to keep yourself safe. So in the state of Virginia, we have tested about 55,000 residents within the Commonwealth. And we have 8,500 positive results for COVID-19. Approximately 1,500 of our residents in the Commonwealth have required hospitalization. And unfortunately, we too in the Commonwealth have experienced death related to COVID-19 at 277 of our Commonwealth residents. If you look closer to home, though, here in the Hampton Roads area, in Virginia Beach, we're actually have the third largest amount of testing of any city in Virginia, and we're at around 3,200 tests that we have. When I say we, all healthcare providers within the community have provided. And on the peninsula, it's close to 2,600 residents have been tested. In terms of number of cases, in Virginia Beach, we actually have 273 confirmed cases here in the city. Chesapeake has 162, Norfolk 111, Suffolk has 91, and Portsmouth 65, and Hampton 83, and Williamsburg 19. That's just a number of the cities within Hampton Roads, just to give you a sense as to how widespread this pandemic is, even close to home.
Wow. Okay. Thank you, Paul, for that. For people that want to go to the doctor's office, Dr. Stevens, is your practice still seeing patients?
Yes, that's a great question. Since the onset of COVID-19 and the governor's stay-at-home recommendation, GenCare has evolved and adapted how we deliver patient care in several ways. For one, we have begun telehealth and televideo with our patients. So in a very short time, we've converted over 90% of our normal office visits to telehealth and televideo. Another thing that we've done is that we understand that we need to have several touch with patients. I think you had mentioned that, staying in isolation, doing things differently can be different for people and sometimes difficult to cope with. So GenCare has started love calls, where we have clinical and non-clinical staff reaching out to our patients, just checking on them. It doesn't always have to be of a medical nature, but we're asking questions like, do you know what to do with COVID-19? Are you safe? Do you know the proper hand washing technique? Do you have enough food in your home? We talk to people about their pets, all the things that they're concerned about. So another thing we've done to kind of make up for that lack of personal touch that we're accustomed to is to have those traditional and non-traditional phone calls. Lastly, we also have made our centers safe. We realize that there's some people with chronic conditions that cannot be managed over the telephone or over video. So we have made sure that we have a safe environment in our centers where patients come in, they're screened, they're given a mask. All of our folks in our staff in our center wear a mask. And people who are involved in care of the patient directly, they make sure they have the adequate protective equipment on as well. And we just make sure that we have social distancing as much as we can in the office. We also provide transportation, so we put that in consideration. So we're trying to keep things as normal as possible, but it's important that the healthcare system and that our staff are still there for our patients.
Excellent. Thank you. Paul, can you talk a little bit about the Sentara testing? You all are doing your own testing now?
That is correct. The Sentara lab has created the ability, or developed the ability, to perform the test ourselves. Initially, we were using national reference labs to send out the specimens. And early on, there was a 48-hour turnaround. And as the pandemic grew across the country, it actually expanded up to almost 10 days in some instances. So we developed the capability. We run it out of our lab at Sentara Norfolk General Hospital, and we're able to do turnarounds sometimes same day, but certainly within 24, 36 at the longest. And we're doing this for inpatients, outpatients, our Lifecare residents, really anyone that needs the test, we're able to process it internally.
Okay, and that brings me to my next question. We have been inundated with questions from our seniors. One of the questions that we got was, somebody asked, could they be tested if they're not showing any signs of the virus?
Yeah, so at this time, we really are testing those that have signs and symptoms. So
Okay.
if they have a fever, shortness of breath, cough, some have abdominal pain, GI issues, then we will, based on their consultation with their primary care physician, it may be appropriate for them to have a test. Early on, we did do drive-through testing at a number of locations within the Hampton Roads area, but they too were requiring to be screened in to have symptoms.
Okay, let's switch gears for a minute. Dave, tell us a little bit about what's going on with our economy. Are we looking at going into another Great Depression? What does the future look like?
Right. Well, thanks, Stephanie. I think it's probably good to start with the idea that this is a health crisis. This is not a financial crisis. before we started this, so if we go back to the fourth quarter of 2019, the economy was in good shape. Unemployment was below 4%. The banking and financial system was in very good order. And so we don't have a financial crisis, we have a health crisis. Now, that being said, because of the health crisis, the decision was made by about 42 out of 50 of the states, and including DC, where the governors decided to issue stay-at-home orders, which effectively shut down about 30% of the economy. Now, that's what leads to the impression that this is starting to look like a depression. So one of the leading indicators that we look at for the economy is the S&P 500, or effectively known as the stock market. Now, what's interesting is it hit an all-time high in February 19th. In a period of 23 days, it dropped 35%. That was one of the fastest and deepest moves that we've ever seen on the downside from an all-time high, which has certainly led a lot of investors to be deeply concerned about it. Now, when we look at the economic output of this country, a couple of the key indicators we look at include retail sales. So retail sales in the month of March was down 8.7%. And I think a lot of us have seen that when we look at the stores that are empty or closed, and a lot of us are not necessarily shopping. If we are, it's online. That 8.7% decline is the largest decline that we've ever seen, with the exception of 3.7%, which is back in November of 2008. To give an idea, that was the previous record. We're now at 8.7%. Industrial production is another measure we look at, and that was down 5.4%. The last time we saw a number anywhere near that was in the spring of 1946. And you got to remember, in 1945, we were fighting World War II, both in Europe and in Japan. After we won the war, all of the industrialization that we had set up gearing for the war, things like tanks and airplanes and munitions and the like, we basically stopped that. So there was a downshift in industrial production after World War II. The numbers that we're seeing now is comparable to that. And again, it's that sudden stop. We also have seen unemployment increase in the past 4 weeks to 22 million Americans. And then this morning, just to give you an idea that this is still going on, we look at the price of oil. In West Texas Intermediate oil is down almost 40% today. And the reason behind that is the demand for oil has dried up significantly, such that production looks like it's going to be ramped down. So when you look at that, our expectation is we expect about a 30% drop in gross domestic product, or GDP, in the second quarter. But our expectation is that we're going to get a pretty quick recovery. And we could see a 29% recovery sometime in the third, perhaps even the fourth quarter. So the debate is whether or not we have a V-shaped recovery, which means we bounce back fairly quickly, or a U-shaped recovery where we come down, it takes a little while to reopen the US economy, and then we recover. So to answer your question, is this a depression? It's entirely possible that this will be the fastest depression that we've ever had, followed by the fastest recovery, and we'll just have to see how it goes. But this is something that, and we'll talk a little bit about this, and I guess in the CARES Act, that we're taking the right measures to make sure that if we do have any slowdown, that it's limited.
Right, that was my next question. So the CARES Act, we've all heard about it. I figured out what it stands for because I Googled it. It stands for the Coronavirus Aid, Relief, and Economic Security. Can you just give us a brief overview of the financial piece of that?
Sure. Yeah, so there's really two significant parts. One has to do with the broader economy, and then the other part has to do with the individual. So this was signed into law by President Trump on March 27th. It's a $2.2 trillion relief package. It's by far the largest we've ever seen and represents about 10% of GDP. So when we look at the economic side, how is this going to help the overall economy? Probably the first part is that it's looking to help small businesses. And one that you may have heard about is called the Paycheck Protection Program. What this is small businesses can effectively take out a loan through the Small Business Administration. And that loan is designed to cover the cost of salary and the cost of keeping employees employed. So a small business owner will keep their employees on the books, and the loan will pay for that. As long as they do not fire any of those employees and they stay on the books and it's part of the business, that loan will be forgiven. If at any time they have a loan that goes above that amount, it'll be basically a low interest rate loan to help start the business. So that first part, the Paycheck Protection Program, is designed to help businesses stay in business. So when we reopen the economy, we'll be able to have the people in place. The other part is called the Emergency Injury Disaster Loan Program, which are grants for small businesses and, more importantly, nonprofit organizations. A lot of nonprofits have seen a lot of their revenue decline, and this is designed to help them. It's also targeting particular sectors of our economy. For example, the airline industry. Any industry that's deemed to be of national security importance is also getting backstopped in this. Different businesses and markets as well. For example, the credit market liquidity is something that's important. It's to make sure that the banking system continues to function. So far, this is working out very well. And then the last part of the major economy is state and local governments. So think of things like hospitals and airports, transportation agencies, subway systems, bus systems, education programs. All that is designed to ensure that the states don't become insolvent during this period of time. Now let's look at the individual, and this I'll take a little bit of time on because I think this is something that's most important for the folks who would be watching this. So I'm going to go through a list of things that the CARES Act does. The first is if you are retired and you have what's called an RMD, or required minimum distribution, a certain amount that you have to take out of a retirement plan. If you're over the age of 72, that has been suspended for 2020. You can also borrow up to $100,000 or 100% of the value of a retirement account. It used to be $50,000 and 50%. It's now up to $100,000, 100%. And you have over 5 years to repay that loan against your retirement account. You can also take a withdrawal up to $100,000 from an individual retirement account like an IRA, even if you're under the age of 59 and a half, as long as you repay that within 3 years. So that's a lightening up on some people being able to access their retirement accounts if they need the capital. There's also the qualified charitable deduction is continuing. This is allowing people to be able to give to charities. Again, nonprofits and charities are still in need during this period of time. There's a thing called the pandemic unemployment insurance, which takes unemployment from 26 weeks, adds on another 13 weeks to make it 39 weeks altogether to help those who are unemployed. But perhaps the most popular part, or the one that we may have known the most, has to do with what we're calling a stimulus check. Basically what this is every individual is going to receive a check for $1,200 a person, $2,400 for a married couple, and then an extra $500 per child. Now, this is not considered taxable income, so it doesn't have to be repaid. Now, there are some limitations on this. If your adjusted gross income is above $75,000 for an individual, then you may end up getting a little bit less than this $1,200. So if you're below $75,000, you'll get the full amount. If you're above $75,000, you'll get a pro rata amount up to $99,000. If you make over $99,000, then you're deemed to not need this stimulus check. If you're married, it's simply twice as much. Under $150 for a married couple, you get the full check. Between $150 and $198, you get a pro rata amount. Above $198, you're deemed to not need this check. There's differences between dependents between the age of 17 and 24 are not eligible, so that's college students. People without Social Security numbers are not eligible. This is for U.S. citizens, so non-U.S. citizens are not eligible for this as well. And this is really designed to target those with the lowest incomes. So if you have a tax deduction, or file for taxes in 2018 to 19, and you authorize the IRS to give a direct deposit for a refund, you will get a payment directly into your bank account. If you have Social Security, survivor or disability, SSDI, or railroad retirement income, you also will get a direct deposit into your checking account for this check. Now, where this comes into an issue is those who are what we call the unbanked, those who do not have this automatic. Those checks are going to be mailed, and that can take several weeks to several months. So what we encourage people to do is to go to the IRS website, look up the phrase, "Get My Payment." So again, "Get My Payment" over on the IRS website, and there's basic instructions on how you can set it up where you can get your payment quicker than the mail. And basically you need information like your birthday, your name, social security number, and the like. And then there's more that's going to be coming. There's another discussion that's going on today in Congress where they pass a bill that could be in addition to all that of the CARES Act. So there's a lot more to come. That's a lot there, Stephanie, but the government is responding and doing so in a very quick fashion.
Thank you, Dave. Walt, can you expand? I know the CARES Act also has some information about estate planning. Can you tell us a little bit more about that?
First, let me say that, Dave, you gave a very comprehensive review of the CARES Act as it pertains to your side of the aisle, the fence that is. I can only think of one more thing that is related to estate planning as well as financial planning and so forth. And that is the aspect of the CARES Act called the Mortgage Holders Relief Section. And what's that all about? Well, good news. If you hold a mortgage, if you have a mortgage on your home, okay, you have a federal backed right to ask for a 180-day forbearance on having to make payments of principal and interest. Wow, that's incredible. It's backed by Fannie Mae, Freddie Mac, the Veterans Administration, the FHA. You don't have to argue that you're either health deficient or economically deficient, not part of the application, but you do have to do an application through your mortgage holder. So I think that that's a significant advantage of folks like myself who have at least one mortgage on our homes and real estate and the like. And I'm sure there's going to be a swell of people applying for that very significant benefit.
Thank you. And, you know, I think that a lot of the people out there, so they're waiting for this $1,200 check. They're wondering what else they can do. And they're thinking that these things are just going to happen automatically. For example, you won't have to pay your mortgage for the next, 90 days, however many days. But they have to take steps. So I think this is great that you guys are telling us exactly what they need to do to take those steps. Anna, let's get to you. So Anna, of course, is at Atlantic Shores. We know that a lot of older people are very susceptible to this coronavirus. What is it like being in a retirement community right now?
Well, Stephanie, it's really different. It's different than what we're used to. We are accustomed to a very lively, vibrant, social community. And we've taken all of the necessary precautions since early March to make sure that we don't allow this virus in. We're taking all of the precautions, with wearing masks and screening and all of that with anyone who comes through the community gates. But we're also sort of making sure that we have to make sure that our residents are still healthy and happy. And that's really a challenge, but I feel like we are meeting that challenge by changing what used to be group activities to more virtual. We have a personal trainer who's going around and doing exercises outside. We've had entertainment outside around each side of every building and through every court throughout the neighborhood, just to encourage people to, see other people's faces from a distance and really just not forget what it's like to have that interaction with another person, because leading isolation can really lead to some other struggles with depression or many other things. So we're trying to make sure to minimize, obviously, or eliminate, if possible, any contact with other people, but at the same time, keep that energy and keep that spirit that our residents are accustomed to. We are equipped, being a continuing care community, we are equipped to handle people who are ill, whether it's from this COVID-19 or not. So our facilities here are very equipped and ready to handle issues when and if they come up. But on the other side, our largest part of our population is that vibrant 55 plus independent living community. And we've done some really amazing things. We have shut down any kind of, like I said, person-to-person contact, but we are screening anyone who comes in, and our staff is doing door-to-door deliveries for people. So if a family comes in with groceries, we are taking it from the family and delivering it to the door of that resident. So we've probably delivered more than 8,000 meals because our restaurants are still in full service. So the people that live here are staying healthy in that respect. And then every day at 3 o'clock, we have a spirit parade. It might be dampened by the weather today, but every day at 3 o'clock, we have a spirit parade. We have residents in their golf carts and in their cars, employees, we have music, and we really just go around to every part of the community that we can get to. and spread some love and spread some cheer to try to keep everyone's spirits high until we can get back to our regular, vibrant, fun, exciting community.
I think we could all use a spirit parade at 3 o'clock. That sounds great.
It's awesome.
I bet. Paul, can you tell us a little bit about the current environment at the hospital today, and how are you guys keeping your morale up with all the work and just all the stress and the lot of patients that you have, a lot more than you used to?
Yeah, so the hospital certainly is a very different environment than where it was just 6-7 weeks ago, where it too was its own vibrant community. But as we've taken all the necessary precautions to, to eliminate visitation, with the exception of very few exceptions, and we're screening everyone that comes in, to include employees. So every morning that I come to work, someone puts a thermometer very close to my forehead and makes sure that I'm okay to come in. And 100% of everyone needs to be wearing masks. And so it's lonely actually in the hospital. For example, we would typically at Princess Anne see around 200 patients a day come through our emergency room over the weekends. And this past weekend, we were at 85 patients per day. So half of what we normally would experience and care for. But, the community is doing an incredible job helping to actually keep us engaged and healthy by continuously bringing food. We have so many restaurants that are donating meals to our employees, and that helps with morale. We have signs and people painting windows. We're doing all sorts of different types of creative things to create sort of community. We're smaller now, if you will, because we don't have all of our guests and we don't have our visitors, we don't have our volunteers here, but we are creating community through various things. And then from this isolation concept that is really felt everywhere across the community, we have resources here for our own employees, not only for the impact that they're feeling at work, but also at home. We have so many individuals that maybe their significant other is not working because of the stay-at-home order, which is fantastic that we did this so early. The governor put this in place. It's really helped to flatten the curve, the growth curve, which we can see. We're seeing it on the hospital front, where fewer and fewer people are coming to us with the virus or virus-like symptoms.
So for the people that are infected, tell us a little bit about, I know that they have a choice. Once you have this, you have a choice of going to the hospital and then, of course, being isolated from your family, or staying at home, but then maybe not receiving the medical attention that you might need. Tell us a little bit about what's going on with that and what you've seen.
Sure. Early on, what we saw was a lot of our community members would come immediately to the hospitals. And a lot of that was because we didn't have a lot of information out there. And we were looking and reading, we all were reading about what was occurring in China and Italy, and then closer to home in New York City, Michigan, Florida, New Orleans. And so there was a lot of fear because we didn't have a lot of accurate information. As time has progressed here, what we're seeing is a lot of individuals are staying home and quarantining themselves as long as their symptoms are not too severe. Mm-hmm. And so if they have flu-like symptoms, they might normally have stayed home in the past. Early on in this process with COVID, they would come to the hospital, but we're seeing now they've kind of bounced back to staying home, quarantining themselves. Of course, if they need hospital care, what we're also seeing is a lot of our community members are using telehealth first. So they're either calling a 1-800 number at one of the health systems in the area, or they're calling their own primary care physician, having a dialogue, and then together with a healthcare professional, making a care plan and deciding where's the best place for them to go. Maybe stay home, maybe come do maybe the virtual visit, maybe an in-person visit, or maybe a trip to the emergency room to the hospital.
Okay, thank you for that. Dr. Stevens, when will it be safe for us to see our family, our friends again? How do we know when that time comes?
Wow, that's the $1 million question, right? Maybe we should ask Dave that. He has all the numbers answers. But this is a question we're all seeking to understand. And I think that we're gaining more knowledge and more education about COVID-19 every day. And it is important that we seek reliable information from agencies such as the CDC, or follow the recommendations of our localities like the Virginia Department of Health, because everything's on the TV, do this, do that, don't do this. So we really want to make sure that we seek the guidance of our leaders and of our clinical experts. So to date, the recommendation from the Virginia Department of Health is to practice social distancing and to stay at home. So we are to avoid public activities and group gatherings. I love the things that Anna talked about that they're doing within their own community, but we have to, use telehealth. We have to maybe pick up the old-fashioned phone and call people so that we can still connect. But unfortunately for Virginia, we're not one of the hot spots to date. Although we do see new cases, we have had some deaths. But I think today we need to follow what our experts have told us, and that's to stay home.
And should we, when we're out in public, should all of us be wearing masks no matter where we are, and gloves?
Well, we absolutely should be wearing a face cover. The CDC has recommended to wear a face covering in public, and that's for people who are over the age of 2 and people who are able to remove the mask if they needed to. But we really want to try to keep the surgical masks and the N95 respirators for those who are involved in healthcare and first responders. So we know that a covering, the CDC has lots of different innovative ways you can make a covering from your face, from bandanas to making your own from t-shirts, but everyone should definitely have their face covered. Regarding the gloves, proper washing of your hands remains the best defense against COVID-19. Most experts agree that gloves are appropriate when you're at a high risk of contracting COVID, such as healthcare workers or taking care of someone who is currently known to have a COVID-19. But I think that we should just consider really that hand washing is the key, and proper hand washing. We talk about washing your hands, for 20 seconds, singing the happy birthday song to yourself, and washing frequently. We know that people who wear gloves, they have to make sure that although they have the gloves on, they don't create a false sense of security where they put the glove to their face and still can infect themselves. And it's also important that you remove the glove properly. So I would say that the number one thing is to make sure you have the face covering when you're out in public. Make sure you wash your hands frequently and appropriately, and save the surgical mask and the N95s for the healthcare system. You can use gloves, but most importantly, wash your hands.
Thank you. So we talked about so many offices and businesses are closed right now. Walt, if somebody does not have an estate plan, but because of all this, they're thinking, wow, I really need one. Is your office open right now? Are you all still doing plans?
Well, in point of fact, we are open. And we are open because the next most important thing in a person's family life, next to healthcare, is if you don't have your estate plan documents in order, especially the advanced medical directive, if that loved one of yours becomes incapacitated, has not empowered somebody to make decisions for your health as well as your wealth, it's a bad situation. And you don't want to be put in that category or situation. Now, everybody has an estate plan. 50% of the adult population have basically defaulted to the statutes of the state that they live in. So again, even though you may think you don't have an estate plan, you do. You put your incapacity or your death in the hands of the court system. About half the people who have done something have done wills, and the other half, about 25% have done something called the revocable living trust. The point is, at least for this discussion, is the most important documents are not wills or trusts. They are your powers of attorney. Because if you become incapacitated, and the more aged you are, the more incapacitated you are, God forbid, if you haven't empowered loved ones to step into your shoes, figuratively speaking, and make decisions with respect to your bill paying and maintaining your home, and very importantly, of course, empowering somebody to make decisions for your health. That advanced directive has three parts to it. It's got what we all euphemistically call HIPAA, the Health Insurance Portability Accountability Act. That was signed into law by then President Clinton back in '96. But what it is, it says, look, our health information is confidential. And the only people who should have access to that health information are those that you designate. You give them the authority to access your medical profile, such as your spouse, your adult children, brother, sister, or what have you. But it keeps the rest of the world out from knowing anything about your health. The second part of that advanced directive is your healthcare power of attorney. If you can't make your own healthcare decisions, you've empowered somebody to step into your shoes, again, figuratively speaking, and make those healthcare decisions for you after talking to the doctor, getting the diagnosis, getting the recommended course of treatment, and so forth. And then lastly, it's the living will. And basically, the living will comes into play. I always like to explain it as we don't want to be a Terri Schiavo. A young lady some 30 years ago at age 26 rushed to the hospital, put on a ventilator. 10 and a half years later, her husband's demanding she be taken off because he argued she was brain dead. Because the lady did not have a living will, she was not taken off life support. The case went all the way to the U.S. Supreme Court. They directed she be taken off, and within, if not minutes, hours, because she was not on the machine, the heart stopped beating, and it was all over at that point in time. The way I like to describe a living will is, hey, I don't want to be a Terri Schiavo. And basically what it says is that when the doctor, that treating team, concludes I'm in a permanent vegetative state, if I'm on life support, take me off. Not on, do not put me on. If I'm in pain, give me something for comfort, but do not do any number of things that just delay my dying. Collectively, they're called the Advanced Medical Directive, which, by the way, is different from the do not resuscitate. Do not resuscitate, kind of a tool that oftentimes you're going into the hospital for a serious operation, or maybe you've had 6 heart attacks at the house and the EMT have been great recovering you and bringing you back to life, but you don't want it again if that ever happens to you. So you put a do not resuscitate on your refrigerator door or wherever the local fire department thinks you ought to have that hanging. But they have a very specific role, and they are not per se the part of the Advanced Medical Directive.
And Paul, I know we had talked a little bit about the DNR and how important that is. Can you tell us a little bit about that and what's going on in the hospital?
Sure. I think Walt eloquently laid out everything very nicely. I think from our perspective in the hospital, this is, well, first of all, this is a life conversation. This is not a COVID-19 dialogue around advanced directive, do not resuscitate, do not intubate. It's a life conversation that everyone should have. You know, I've done it with my wife and my daughters on a healthy, calm, rational discussion, because what we see so often is when it's an emergent situation, you know, emotions take over. So in the hospital, emotions take over, and it's just devastating to see a family really kind of come apart at the seams when this is not all in order, and it's devastating. And so you have multiple victims, not just the patient, but you also then have the family members that can become extremely divided because rationality goes out the window. It's all emotion driven. Mm-hmm. And so the other conversation that we ask people to have is, if you're end of life, where do you actually want to pass away? So if you are a DNR and you are a DNI, do not intubate, is the hospital, if you have the option, is the hospital a place you want to pass away, or would you rather do it at another location, maybe at home, maybe in a hospice home? There are other alternatives, because as you know, I've been in hospitals my entire career. We've all been in them, but they tend to be, it's a room, it's unfamiliar, it's cold, it's sterile. And when you do have a pandemic like COVID-19, then you can't even have all of your loved ones around you. Mm-hmm. And so having this discussion way in advance eases doesn't ease the pain of someone passing away, but it certainly helps it make it more of a collaborative ending, and probably an ending the way that that individual had intended to, because no one intends to have their family torn apart by having to make tough decisions at the last minute when they hadn't planned ahead of time.
Right. It really is all about planning. Back to you all. Another question that we've gotten is for people that may have an estate plan in place, but let's say they put it together 10 years ago. Will they still be able to use it? Will financial institutions take it if it's not a year old or less than a year old?
Sure, and we'll also let Dave weigh in if anything I say is inconsistent with Morgan Stanley's criteria. If the estate plan is done right, and let's concentrate on the living, so let's concentrate on the advanced medical directive, which is the essence of this discussion. If it's done right with the requisite 2 witnesses, notary, witness confirming that the person signing the advanced directive has capacity, the notary confirms that it really is Walter Zaremba who signed his advanced medical directive, and so forth. It doesn't matter. And by the way, I often hear that there's a rumor around town or around the area that your powers of attorney, if they're more than 3 years old, are illegal, no longer valid. That's poppycock. So long as it's done properly, it really doesn't matter, legally speaking, if it's more than 3 years old. It could be 20 years old. It could be from another state. But if you're dealing with a financial institution such as Morgan Stanley, they may have criteria, internal criteria, whether or not they'll accept the power of attorney, regardless of how legally efficient it is, and the like. And so you might have to sign on to, or maybe some of these organizations even have their own internal power of attorney. You might have to go with that general durable power of attorney that Morgan Stanley mandates, if they do. Maybe you can kind of answer that question. But I know some do and some don't. The advanced directive, on the other hand, ought to be good regardless, so long as it has all the requisites of the legal document. It doesn't matter how old it is. It doesn't matter where it came from, if it came up from Georgia or out in California, the like, even though they have their own internal legal requirements. Generally speaking, the advanced directive is valid across the country.
Okay, Dave, you want to weigh in on that?
Yeah, absolutely. Paul and Walt have done a very good job kind of talking about some of the challenges that a lot of people will face as we get into really situations where individuals may not be able to make decisions for themselves. I know for me personally, I like to describe it that my mom and my dad both gave me a parting gift. A challenge of morality is like how I like to describe it, because with them, as I had the privilege as an only child of taking care of them in their final few months, they had directives for me in their revocable living trust, in their advanced medical directives. And so for me, it became kind of a puzzle of making sure that I was going to meet what they wanted. And it helped me a lot. And they took the time ahead of when they got to that stage in their life. We had family conversations. And really, at the end of the day, this whole thing is about planning. It is certainly, there's legal issues and there's moral issues that's important to think about ahead of time, but you have to do it with your family and make sure that those who are you entrust to care for you and to make decisions for you are well aware in advance. So this is the type of thing you really should plan for. On us, on the professional side, what we've been doing, and we do this on a regular basis, certainly a part of updating financial plans, but we've accelerated a little bit more during the past couple of months, is you want to make sure that you have financial power of attorney on file. We want to make sure that the beneficiaries are correct, right? So let's make sure those beneficiaries on things like IRAs and annuities and any retirement plan is correct. Things may have changed. If you haven't updated your beneficiaries in the past 10 years, things could have changed. We want to make sure that they're up to date. And then perhaps most importantly is, who's the trusted contact? If something happens to you, who should I talk to? Because after all, you still have financial obligations that go on, right? So you have different things. You got to pay bills. You got finances that you have to take care of. This is all something that we got to make sure that there's someone who can act on your behalf. And there's one other thing that's just starting to show up, and maybe Walt can comment on this. There's thing called a digital power of attorney, right? So if I go onto a website, I have a username and a password, but I'm the one with the username and password. It's important to make sure that whoever you give power of attorney to has access to those username and passwords. So you either keep a file at home, make sure it's safe, or you have some type of digital power of attorney as well, so that individuals who are there to care for you can have access to it. But yes, this is a tough question, and this pandemic highlights the importance of making sure you do it ahead of time. And certainly the hospitals would appreciate it. The state planning attorneys are very well versed at it. Certainly Walt's office is very good at it. And firms like ourselves here at Morgan Stanley, it's something we keep a very close eye on.
Very good, thank you. Anna, I know that many of your residents, of course, are in a CCRC because they have planned and they've said, this is where we want to be. We want to be as independent as possible. You know, a lot of them hopefully are close to their families. That's, I think, a big choice when people are choosing a retirement community. What are you all doing right now to help bridge that gap where family can't come to visit, but the residents still want to be able to keep in touch with them?
I'm going to say we've been ahead of the curve for a little while. We have an on-site IT person who's an expert. Jamie has been holding technology classes for residents for years. We have a technology committee that's made up of residents who live here at Atlantic Shores who have really worked over the last couple of years, no pandemic in sight, to make sure that our residents and our community is really up to speed on how all of this technology works. So we've taught people how to use FaceTime. We've taught people how to use Google Duo. We even have some devices that are owned by the community that if somebody's having difficulty or they don't have a way, you know, maybe they have a flip phone and they can't do a face-to-face call, we have some devices that we can set up and actually just lend out so that they can be put in touch with their families. And we as staff members tend to become family in a sense that we really reach out and we are trying to make sure to keep tabs on everyone. And we know those people who don't have family in town, or maybe they don't have family at all. And we really kind of try to serve as that go-to for them for support in an emotional way, as well as for, you know, obviously through the services that we provide here.
And then how are you all as a retirement community able to communicate with the family members to just let them know what's going on as a whole? What are you all up to? Are their parents safe?
Mm-hmm. We are using a system called Care Merge. So two things. Care Merge is the first one. This is like a digital online community where our residents can all have access to it, where they can go on and check menus and schedules and activities, but family members can also sign on to Care Merge and get the updates, the notices from our executive director, and our management company, Lifecare Services, sends out announcements. So those are all housed in this platform called Care Merge, and it's really easy for us to kind of put a blast out there and let everybody know what's happening. For those people who are not as technically connected, and they are out there, we are using a new system called One Call, where it's actually just a blast phone call to people's landlines, and everyone here at Atlantic Shores has a landline. And then families can enter in their cell phone number as the contact, so we can put out a phone call to everyone, just kind of giving them a message if there's any update, any emergency, or anything that everyone just needs to know. So we're trying to really be that liaison and make sure that nobody slips through the cracks, because there are people who are not tech savvy and there are people who don't have families. So we really try to step in and make sure that those people are not missed in this strange time where we're all behind closed doors.
I'm sure that is very reassuring to the families and to the residents as well. We're going to go ahead and just do some last minute comments, questions, thoughts. Dr. Stevens, I know your practice specifically specializes in working with seniors. I'm sure you're getting a lot of phone calls, many of them even non-related, like non-medical related phone calls. What are you telling your patients if they're calling you and asking how to find out about local services, and maybe where should they be getting their information from?
You're absolutely right. You know, seniors are at high risk of suffering the ill effects of this whole pandemic, not only medically, but also socially, economically. And so we have trained our staff, clinical and non-clinical, how to talk to patients, how to assess their needs. You know, do they have food insecurity? how are they doing with their utilities, how they're doing with their regular income that they were accustomed to, and have they reached out to family, who's in their social circle. So I think what we have to do is to reach out to people and to make sure that we're asking the questions and just, how are you doing? What do you need help with? So that's what we're trying to do in our practice with what I mentioned before in our love calls. We also have case managers and social workers who are here to help with our patients. We talk to them about their social economic status, their bills, are they able to pay their rent? Just make sure we have those sometimes difficult conversations, but to let folks know that we're here for them. There are websites you can go to. There's an Aunt Bertha website that has a lot of outside resources. The Virginia Department of Health has resources, as well as your city and local websites. If folks are able to get on the internet, there's lots of information there, but I think it's important that we let our seniors know to pick up the phone and call someone, call a family member, a friend, a neighbor, a trusted person, to let them know how you're doing, and we're going to make sure we check on them as well.
Thank you. Paul, what do you see with the future of healthcare after we've gone through this? Are things going to change a lot in how we implement different services?
Yeah, we absolutely expect that things will change. We won't just snap back to the normal that it was 8 weeks ago. And even if it did, I'm not sure we'd recognize it.
Mm-hmm.
I'm not sure we'd want to. I think actually as healthcare leaders, in this community and across the country, we're going to use this to actually improve what we're currently doing. And so one of the things that I'll highlight, and Dr. Stevens already spoke to it, is the expanded use of telemedicine. I think, we've been doing that in hospitals and in clinics across the country, and particularly in more rural areas, you see it heavily relied upon. It's been a little tougher or more challenging to get it, get that adopted by individuals. And so through our health plan, Optima, through our Sentara app, and many other health systems will have similar types of tools, different ways for us to connect with the community members that choose us for their care. So, and then helping to triage our community members to get them to the right place at the right time for the right care. Don't just come to the hospital, because so many times that's not the right place. And but once you come here, we have to care for you, for instance, in the emergency room, because there's federal laws that require us to see someone if they present. But so many of our members, we could have taken care of urgent care or in primary care, or maybe even just through telehealth visit through their cell phones. So I see that as one of the major opportunities that we have as healthcare providers in this market, but as well as in the country.
Thank you, Paul. Walt, what is the best advice that you can give your clients from what you've learned by going through this crisis?
Well, I think Paul hit it on the head, and that is, especially since most of our clients are seniors, I would say 55 and older, although we have younger as well. And the older the client, the less he or she generally knows about technology, digital technology. And so if it's one of two recommendations I would make to the audience is, hey, time to get a little bit proficient in being able to use your smartphone, or get a smartphone, get a PC, get a tablet, kind of learn the fundamentals of being able to communicate that way, because that's the way of not just the future, but now. The other thing I've learned is that, boy, it takes a crisis, a pandemic, to get people off their backside to start to do things that they should have done much earlier in their life. And that goes right back to those powers of attorney. And forget your will, forget your trust. Right now, while you're living, try to lessen the burden on those that you love by putting simple powers of attorney in place. As Dave points out, the general power of attorney to empower somebody to manage your finances, manage your home, pay your bills, and so forth. And then, as our medical team here points out, that somebody's got to make decisions. If you come into that emergency room, or you're living in a CCRC and your health goes south, If you haven't put powers of attorney in place, you really put a burden on your loved ones because they're going to have to go to court. They're going to have to go to the circuit court of the municipality that you happen to be living in, and the judge is going to decide whether or not to empower them to be your healthcare agent or your agent for your general dual power attorney. So just one simple word: do it. That's all you have to do. Do it and put your estate in place. Thank you.
Thanks, Walt. Anna, what would you say to somebody who is maybe thinking about moving into retirement community, but you know, they're scared because of everything going on right now?
I would say that it's normal right now to feel scared to move forward in the process. When I call it shopping, when you're shopping for a retirement community or the next stage in your life as far as living is concerned, but I wouldn't let it stop you. We have been able to safely facilitate move-ins that were already in progress. We've made some changes in the way we can show off the community by video tours, by virtual tours. We can really, most of the time I hear people say once they get here and they move in that they wish they had done it sooner. So I think that like Walt was saying, it takes a pandemic or something crazy like this to happen to get people to sort of move forward with things that they have maybe put on the back burner. I called it forced change when I had to start doing video messaging to people who call in, but it's a really good thing, and those things are going to last and they're going to carry us through to the next stage of our lives. And so I would say I would not let that stop you. People always say they wish they had moved sooner, and so next time something happens in our world, whether it's a hurricane or a snowstorm, you could be living in a community like Atlantic Shores, and you could have some of the really the necessities that you might otherwise feel are in danger of being solid, really taken care of for you. So moving on to the next stage is going to prepare you for the next time something happens. We don't want it to be a global pandemic. A hurricane comes through a couple of days, a snowstorm a couple of days, but during those times when you might lose power or not be able to get out of your driveway to get to the grocery store, you would be into the situation that you envisioned yourself being before it happened. And so in that respect, I would say don't let it stop you. It may slow you down, but don't let it stop you from moving forward in that process.
Thanks, Anna. And Dave, that's a perfect segue. Dave and I were talking offline, and I remember you saying, wow, to be in a retirement community right now is probably one of the safest places that you could be. So comment on that if you would, and then can you give me 3 things maybe that we should be doing right now to make sure that our finances are going to be okay after this pandemic?
Sure. One of the, the retirement community industry, if you will, is a very large industry, and it's under a little bit of stress right now, right? So at least from a perception perspective, but it's a very important part of our communities, of our lives, and I'm very confident that that industry is going to emerge from this stronger and better than it ever has been before. So I remain very optimistic about that particular segment of our community. So please don't take this time to be afraid of them. Understand that these people who run these types of communities are learning from this pandemic, learning from this time, and are going to make it much better. So please, stay confident in those particular part of our segment. As far as 3 things, I thought about this a little bit. So as a financial advisor, the first thing that we would recommend is absolutely make sure that you review your entire financial plan. We talked about power of attorneys, we talked about beneficiaries and the like. That's an important part of the plan. That's your estate plan, but the financial part matters as well. We've seen a lot of changes in asset pricing. We've seen changes in asset allocation, and I'm sure that we've seen changes in individuals' income and their expenses. I don't think we're spending as much as we used to. Certainly things like vacation and that discretionary spending that we do, that has really dried up. And that can have an impact on your financial plan. But it's really important that you take this time to review your financial plan, check with your financial advisor. If you don't have a financial advisor, by all means, reach out and find someone that you can trust and that can take the time to help you get through it. So it's really important that you review your financial plan. But the one part of the plan that I think is also important, and it would be the second idea that I have, is to take a look at your debt. We didn't really talk too much about it, but Look at things like your mortgage. Interest rates have come down. This may be a time to look at refinancing, consolidating any debt you have. You move into a kind of an economic slowdown, make sure you keep an eye on your debt. Don't let that get away from you. And that's something that's really important. So take care of yourself in that regard. And then probably the third one, Stephanie, and this to me is something that extends a lot beyond everything that we've talked about here, certainly beyond the financial side, but it's to keep the faith, right? We're all going through a really tough time right now. For many of us, this is not anything that we've seen in our lifetime. We have seen economic downturns. We have seen natural disasters in terms of hurricanes and the like, but we haven't seen a global pandemic like this. So this is a very difficult time. It's unusual. It can be frightening. And for many families, this is actually a very difficult time. So we got to make sure that we remember that we're going to get through this. This is not a time to panic. This is a time to take care of yourself. And I think we covered a lot of different things today to take care of ourselves, make sure that we're in good order and that our life is in good shape as we come through this. But then the last thing, and I'll probably leave it like this, the best way that you can take care of yourself, Stephanie, is to make sure that you take care of others. I think that's something that echoes through everyone on this panel today, that we're always thinking about how is it that I can help someone else. And I was thinking and reflecting on what the White House issued as far as the 3 phases to how we can reopen the economy. And the one thing that starts off with is it talks to those who are vulnerable, that it's going to be a while before they're able to re-engage with our society and with our communities the way that they used to. We need to think about them. But if you're in that group of people that we describe as the vulnerable, don't think that you have to be cooped up inside. You can be a contributor to that as well. I was talking to a very good friend of mine this weekend who's a deacon, and he was asked by the pastor of his church to get on the phone and call people and just ask them how they're doing. Checking in with them, see if they needed anything. You know what, you can do that from home too. Just because that we're all kind of shutting down doesn't mean that we have to stop thinking about each other and stop caring about each other. So I'll put that out there as probably the most important thing. We're going to get through this. We're going to get through this by doing this together. So those are probably the 3 things, Stephanie. Make sure you review your financial plan, take a look at your debt, make sure you're okay, and make sure that you take care of each other.
Thanks so much, David. And thank you to everybody. I know that you all have very busy schedules. So we so appreciate you coming on and doing this. I know it's going to be great information for the people that get to view the video. I'd like to note that at the end of this video, each panel member's biography and contact information will be shared so that you can contact them and follow up directly. You can also follow us, Senior Advocate, on any of our social media sites. They are listed on our website, which is SeniorAdvocate.Live. Thank you for watching, everybody. Stay safe, and we hope to see you soon.